Hello there, welcome back to Coco Campus. Here's yet another exciting video about the humerus, the funny bone. It is the longest and largest bone of the upper extremity. Let's look at the various positions we can view a humerus in. You can see the anterior side, the lateral side, the posterior side, and medial side. Let's look at the proximal landmarks on a humerus. You have the head of the humerus. It is on the medial epiphysis. Its functional association is the glenohumeral articulation. Next up, we have the anatomical neck. It is subarticular, which means it is the attachment site of the capsule. Then we have the greater tubercle. It's on the lateral aspect. Here's the insertion of your rotator cuff muscles. Next is the lesser tubercle on the anterior aspect. Here, amongst the rotator cuff muscle, specifically you have the subscapularis muscle insertion. Then we have the bicipital groove or intertubercular sulcus. Here's where the long head of the biceps brachii tendon attached to. Moving on, let's go towards the shaft of the humerus or the diaphysis. Here, we can see on the anterolateral surface the deltoid tuberosity. Here's the insertion of the deltoid muscle. On the posterior surface, we can see the radial groove, also called spiral groove. Here's where you see the radial nerve and deep brachial artery. On the lateral border, you can see the lateral supraepicondylar ridge. Here's where the extensor for your forearm muscle originates. Moving on, let's go on towards the distal extremity or the articulation of the elbow. You have the medial epicondyle. This is non-articular, which means it is not forming an articulation or a joint. Here's the ulnar nerve pathway. Then you have lateral epicondyle, another non-articular landmark. Here's the origin for your forearm extensors. Then you have the trochlea. Here you can see the articulation of the ulna, hinge motion. Then you have the capitulum. Here you can see the articulation of the radius, rotation movement. Moving on, you have the coronoid fossa. It's a depression. This receives ulna's coronoid process inflection. Then you have the radial fossa, another depression. This receives radial head inflection. And finally, you have the olecranon fossa on the posterior side. It is also a depression. Here's where the olecranon process of the ulna, and it can only be seen as it receives when the arm is fully extended. Moving on, let us look at clinical traumatology, the important tips. The clinical assessment of humeral trauma is often guided by the arm mnemonic. Identifies the nerves at risk based on level of fracture. A in arm stands for axillary nerve. This is seen on the surgical neck. Surgical neck site of fracture, the nerve at risk is the axillary nerve, and the classic clinical side is weakness of deltoid. Moving on, R in arm stands for radial nerve. The site of fracture is mid shaft. The clinical sign is wrist drop. Then you have M, median nerve, supracondylar fracture site. The classical clinical sign is an ape hand or hand of benediction. And then you have the medial epicondyle, where the ulnar nerve is at risk, and the classical clinical sign is ulnar claw. I hope you get to learn this in a fun and easy manner, and I'll see you again with another video. Take care.